Disney's Christopher Robin once told Winnie the Pooh, "You are braver than you believe, and stronger than you seem, and smarter than you think." Every nurse has a fear of failure when providing care to someone depending on them. During the COVID-19 pandemic, we have depended greatly upon the nurses and healthcare professionals that are working tirelessly to ensure the continued health of those affected by this virus. Healthcare workers on the front lines of the COVID-19 pandemic are exposed to the coronavirus on a regular basis, posing apparent health hazards. However, the public health crisis is having a negative impact on the mental health of our nurses, leading to anxiety, stress, sadness, loneliness, and other issues. While many people in the United States are dealing with the fear and uncertainty of the COVID-19 from the comfort of their homes, vital employees such as healthcare personnel must be exposed to the virus on a daily basis. Healthcare personnel, are also working in situations that are compared to a war zone, as they constantly witness the pandemic's direct effects as it sweeps through communities. Nurses who were burned out were quitting the workforce at an alarming rate even before the pandemic, as nurses were also put at a higher risk of suicidal thoughts, and bad mental and physical health concerns were a result of this. This departure has added to the already existing nursing shortage, which has already had a negative impact on the patient care quality. Nurses have been compelled to work additional shifts and longer hours due to the shortages of nurses in the workforce, putting them at risk for burnout and poor health. A key problem in the COVID-19 pandemic has been caring for infected patients, which poses a serious risk to intensive care unit employees due to the requirement for continuous interaction with infected patients for extended periods of time. Widespread infection and fatalities among healthcare workers have previously been recorded for MERS and SARS and are currently being reported for the COVID-19 disease, putting significant social and mental strain on the workers. During the SARS and MERS outbreaks, healthcare workers expressed their fears for their own safety and their families' health, as well as their unpleasant experience of fear, anxiety, and even social prejudice and stigma. Burnout is defined by the World Health Organization as a protracted response to workplace stress that is not successfully controlled. Burnout was reported by 15.6% of nurses in a national survey done among nurses in the United States in April 2019, with nurses in the emergency department having a higher risk. Nurses working in the emergency department during a pandemic face a number of challenges, including coping with dangerously ill patients and emotionally overburdened relatives. Burnout syndrome is defined as a long-term exhaustion combined with a loss of drive and interest in one's job, resulting in decreased productivity. This is the outcome of putting in too much effort at work with few opportunities for recovery. According to studies, high-stress professions are more likely to lead to job burnout. When the focus is on the nurses, job burnout may result in decreased willingness to take on leadership roles, a decrease in the quality of healthcare, a decrease in the satisfaction level of hospitalized patients, an increase in the number of health-related infections, and higher rate of patient mortality. Previous research has also found that nurses who are experiencing job burnout are more likely to be dissatisfied with their professions and look for ways to leave. Nursing is one of the most demanding professions. Burnout syndrome is frequent among healthcare professionals, particularly in the field of nursing. Some professionals are able to handle the symptoms, but those who are unable to adjust to long-term working circumstances, a lack of professionals, and poor communication are likely to become physically and emotionally exhausted. Nurses' ability to deliver care is harmed by burnout. Every day, nurses must face the challenge of being human, compassionate, and sensitive in a demanding work environment. Professionally revealed problems of patients, such as costly recovery or non recovery, as well as a lack of capacity to deal with gloomy situations such as death, can lead to a sense of powerlessness and professional unhappiness. As a result, burnout prevention in health professionals such as nurses is critical in promoting the physical and mental well-being of these service providers. Workplace burnout has an impact on one's personality, performance, and productivity. In the long run, the disease's emotional responses can generate mental strain that is difficult to overcome on its own. So, how can we change this outcome? Nurses must first identify the indications of burnout in order to prevent it. Nursing burnout can manifest itself in a variety of ways, but it is usually associated with a few symptoms such as exhaustion, dreading going to work, feeling underappreciated, and being constantly overwhelmed. The fire in the belly needed to bring about change has to start at the top in order to shift from a culture that is satisfied with the status quo to one that is ready to change. Hospitals and physicians have a crucial role in this. The hospital will not be ready to change until they are ready because they set the tone for the hospital. It is hypothesized that the degree of stress and burnout experienced by nurses is a consequence of their own work environment and coping mechanisms. Individual qualities, resilience, and coping skills are all individual influence how a stressful situation is viewed. Nurses might benefit from a variety of measures to help them avoid burnout. Meir et al. Described a resilience training program that teaches nurses professional skills for coping with cognitive behavior while also boosting their resilience to the obstacles that come with the job. They claim that coping skills training can be used to teach, build, and strengthen resilience. Meditation has also been suggested as a tool for reducing stress, particularly in nurses. The technique, is based on how stress is perceived, and stress becomes easier to manage with meditation practice, regardless of the source of stress. According to Alexander et al., yoga practitioners reported decreased emotional tiredness and depersonalization after 8 weeks of practice, suggesting the efficiency of this sort of action in preventing burnout among nurses. Hospitals have the opportunity to offer teaching of these coping strategies to their nurses and other healthcare professionals in an effort to thwart nurse burnout. Offering this teaching along with one paid yoga class per pay period or even per month can promote a healthier, more stable nursing staff. The cost for teaching and paying nurses to go to a yoga class is far less in monetary value than it is to seek for new nurses, orient them to the unit, and to pay for unnecessary mistakes due to nurse burnout. Moral distress and burnout have been linked to the nurse's role as a patient advocate and have been identified as potential sources of these dilemmic phenomena of care versus cure, conflicts between legal and ethical obligations, perceived powerlessness, power differences, and excess responsibility of nurses due to a shortage of nursing staff. Despite the oh my goodness, the implications for the users, which can be strongly associated with moral distress and burden. Nursing workers can reveal themselves to be afraid of provoking questioning when faced with moral problems, possibly due to the inequality of power experienced in the work environment, within the nursing team itself, and in the institution as a whole, despite the implications for the users, which can be strongly associated with moral distress and burden. In conclusion, I pose that implementation of teaching nursing coping strategies for dealing with nurse burnout, as well as promote and provide outlets for nurses and healthcare professionals to ease burnout, teaching our nurses and healthcare professionals that they are braver than they believe, stronger than they seem, and smarter than they think, will encourage a nursing staff that will promote health and safety. Having facilities that will promote this will encourage our nurses to to not experience nurse burnout. Thank you very much.